Hey everybody, today for WhyWeight Wednesday, I'll talk about the first appointment. And so sometimes making the first appointment is the hardest part, and that's understandable. Patients might be nervous, not sure if they want to go ahead and make this first step. And so today I'll try to make this video to help ease patients through this, to learn a little bit more how we do it here at WhyWeight.com. And so we'll help learn a little bit more about the first appointment. So the appointment starts by either getting a referral from either your primary care physician who wants you to help optimize your health, get your blood pressure better controlled, cure diabetes, help your sleep apnea, or from maybe an orthopedic surgeon when you have an upcoming knee operation and you need to lose some weight prior to surgery to get better, to get a better and safer outcome. That's going to be one option to get here, as well as if you just have an interest in yourself losing some weight, getting healthier, and feeling better. And you can do that through our website or by calling our insurance department. So however you get that initial referral or make contact with our office, you'll get directed to our insurance advocates. And so what they'll do is they'll verify your benefits. Once you have verification, then they will go ahead and schedule your appointment. And we have many locations about getting you into the office, as well as we're doing virtual appointments. So after you get that appointment scheduled, you'll see us for our initial consult. Now, regarding the initial appointment, this is the first step in your weight loss journey. And I love this appointment. This is where we get to meet each other. You get to meet me, I get to meet you, you get to meet our amazing team. And so we start this journey together, make sure that we get all of the questions answered, you feel comfortable moving forward, and we try to truly personalize what is best for you. In order to do that, I'll look at what's called the BMI, and that's the body mass index. And so I'll use your height and your weight to gather a number. And this number is not perfect by itself, but along with your past medical history, whether that's high blood pressure or diabetes or heartburn or sleep apnea, together we'll decide what we think is best for you to get the most weight loss results and also to have the best quality of life. This also incorporates what you're interested in. So if you come here already knowing what you are interested in, we're probably going to go down that pathway. Meaning if you are interested in non-surgical weight loss, medical, seeing dietitians, doing protein plans, we'll likely choose that pathway. But I'm still going to go down the options and offer these to you to let you know what you have available. And this is the same from a surgical standpoint. If someone is seeking surgery, I'm still going to give you the options that we have here to make sure you're aware of everything that is available to you. So using the BMI and your past medical history, we will truly personalize what we think is best for you. And so an example would be if someone has a BMI of 40 or greater, well, I personally feel like this would be a good patient for a surgical option. Meaning, if you want to lose a significant amount of weight loss and also get long-term results, if someone has a BMI of 40 or greater, I typically recommend surgery. We talk about what kind of surgery is going to be what they're interested in. It also goes with their past medical history, and we incorporate all this together to truly personalize what is best for them. If someone has a BMI of 30 or less, well, maybe it's going to be non-surgical, medical options, intermittent fasting, diet plans, seeing our nutritionalists, dietitians, or maybe even do medication, which we have different combinations we can help to get you those results as well. For someone with a BMI between 30 and 40, it depends on their medical problems. Some may benefit from surgery. Some may benefit from non-surgical options. And then there are the endoscopic, incisionless options, which are typically the gastric balloons, as well as the endoscopic options. The main one we do here is going to be the ESG. It's the endoscopic sleeve gastroplasty. And so we will go ahead and tighten and make the stomach smaller to give you restriction. And this is a great option for someone that does not want or maybe not need surgery, but doesn't want to do just medicine alone and they've tried that in the past. So based on your BMI and based on your medical problems, together we can talk about what options are available to you and then find out what we think is best for you. So some of these options are going to be insurance based, meaning some insurance companies cover the options and some don't. And so we, again, have a team of insurance advocates that will help navigate you through this process and make sure you have benefits that get you qualified for surgery. And the other good thing is that with all these options that we have, you don't have to decide what you want to do today or at the initial visit. Take time. Think about what you want to do. Think about what results you want. Think about the options you have. Talk to your family or your friends. And again, you have time to do this. During this process, we'll go through the insurance requirements. And so some patients have multiple visits to do. You might need a psychological visit. You might need to have a sleep study, do some blood work. So at each visit, we will reevaluate what is needed to do from an insurance standpoint, and then also talk about how to get you feeling better. We'll go through a pre-op diet, We'll talk about what options you have to get some weight loss prior to surgery to get you feeling better. And again, try to find out what is best for you. So again, this is the initial consult. This is what I like. This is why I like it. You get to meet me, you get to meet our team, and we get to be a part of one of the best chapters of your life, which is going to be the start of your weight loss journey. So I hope today's video was helpful. I hope you got some information. Feel free to leave any comments below, and any questions you have, just let us know. So have a great week, and see you next week. Thanks.